Good afternoon, ladies and gentlemen, and welcome to the Portland School District Podcast. This is our episode number 15. I'm your host, Dave Kosminski, and with me in the studio is our Superintendent of Schools, Dr. Charles Britton, and just back from a kind of a week respite. How do you feel after a little vacation, Charles?
Oh, it was delightful. It's really interesting. This is 25 years now. The first year of my career where we were out as early as we were.
Yeah.
I mean, I feel like every other year of my career there was a hurricane or a freak October
Snowstorm.
snow blizzard storm, or and most times we're going to school late into June because of snow days. And this year, we still would have been if it were a normal year. We would have been in school last week with kids here. I never take vacation when kids are in session. But of course, because we were able to do the remote learning days,
Sure.
that got us out at
Absolutely.
3 days later, because we did have 3 snow days.
Yeah.
Than we had anticipated. So last week was kind of like a found week.
Yeah.
And it was a great week to use a few vacation days, after an outstandingly beautiful graduation.
Came off well.
Thank you for all your work on that.
No worries.
But that's one of the things that I have yet to receive guidance on, and I'm waiting anxiously, is whether next year we can make snow days remote learning days.
I tell you, I think it worked out well. I think
it was great.
If anybody, and I think every other school district, I think it would kind of concur on that.
It was wonderful. It was wonderful. Now, of course, there are pros and cons. I guess they worked well this year because we were all geared up and knew how to do it. Right?
Yep.
It would just be a matter of importance that all districts kept those skills sharp.
Sure.
For the 3 or 4 days if we
Absolutely.
were remote. And it would be a lot of work, but I think it's something we certainly have the ability to accomplish.
Oh, absolutely. And I think, the fact that we've done it, and again, it's just a matter of, keeping those skills sharp and, just keeping it in the toolbox. And when it presents itself, we take it out.
Absolutely.
For sure.
Absolutely.
So anyway, going forward, I think you've got some new marching orders from the state. So, let us enlighten us.
Yep. So I would love to spend some time with you and anyone listening to this today talking about Portland's, here's the fancy name for it, Safe Return to In-Person Instruction and Continuity of Services Plan, right? So every district in the state is required to have developed and posted on their website this Safe Return to In-Person Instruction and Continuity of Services Plan, right? It's a little bit weird to have to do this because, hey, we've been in person and had a safe 5-day-a-week, everybody in K-12 since last February.
Sure.
So we're not reinventing the wheel here.
Exactly.
Our plan is simple.
Yep.
To continue doing what we're doing and have schools open 5 days a week. We are going to close the PVLA and kids are coming back.
Yep.
So the reason that we have to talk about this plan is that the federal government has required us to develop this plan so that we can have access to the federal money that's coming our way.
Yep.
So it's a pretty important plan to have up there and ready to go because I want access to that federal money. I have a lot of really good ideas for it, and we won't talk about those good ideas at this podcast, but I have a lot of good ideas to share coming next year. So I would love to I did post a letter and explained a little bit about our plan for next year, and I'd love to spend some time with you this morning talking about it. And then, of course, would invite anybody with any reactions to the plan that my leadership team and I and everybody I work with have in mind, which largely is open schools for all kids 5 days a week.
Sure.
To give me an email, cbritton@portlandcdt.us, or call the office and talk to me and give me feedback.
Sure.
So let me just run through a few things. One of the things that we're asked to reflect on is mask wearing. And I know, of course, everybody does, that this was a very contentious topic this year. I am not prepared to say today if kids are going to be required to wear masks next year.
Right.
It is my hope that they won't, that we can leave it optional. But we are going to defer, as we have all the way through the pandemic, to the advice of local and state health experts and our Department of Public Education.
Yep.
If it is an expectation that students wear masks, we will enforce that expectation.
Mm-hmm.
If it is a recommendation, we'll make it a recommendation. So it's too early right now to say whether masks are going to be required next year, but stay tuned.
Yeah.
And I think a lot of that is going to depend on vaccination rate, community transmission, and if and when a vaccine becomes available for kids birth to age 12.
Yeah.
If that vaccination for birth to age 12 is here, available to everybody, people take advantage of that. It is effective, and rates of community transmission are low. I expect we'll see everybody smiling faces without masks next year.
There you go.
That's the hope. Second thing I just want to talk a little bit about is physical distancing.
Yeah.
The second major strategy was to spread kids out. We put enormous amounts of work into that this year. We redeployed our reading specialists and our library media specialists. We taped off rooms. We made classes small. We created cohorting. We did a lot, and it was very disruptive. And it was difficult for a lot of our teachers to keep kids 6 feet apart.
Right.
Same thing, though. If we have to do that again next year, we will.
We'll have to do it.
We have to do it. If we don't, I am certainly hoping we will not have cohorts. We will not need to redeploy any of our teachers out that are librarians or reading teachers, and we'll be back to normal.
Sure.
Again, that all depends on transmission in the community and vaccination rates.
Mm-hmm.
So it's premature to say for sure what we're doing. We still have 8 blessed weeks of summer ahead of us.
Yeah, let's not rush that.
Yeah, let's just enjoy and see what happens.
Sure.
And we are prepared to implement strict social distancing as we did at times last year, or not.
Well, they relaxed the 6 foot
Right, to
distancing
3. Yep.
to 3. So
Yep.
whatever, but I think and I think that was justifiably so.
Sure.
Okay.
And so we created 6. We knew how to do it. We figured it out.
Yeah.
And we did it well, and we did it with fidelity, as best you can with certain age groups of kids. But we're prepared to do it again.
Helps when you have a tape measure.
Yes, yeah, and small classes of kids, and we figured it out.
Sure.
The next one, of course, was maintaining healthy facilities, which meant cleaning regularly, sneezing into your sleeve, hand washing, sanitizing. Again, last year we went way overboard. I mean, we closed schools on Wednesdays or went remote on Wednesdays so we could do full-scale cleaning.
Yeah.
We had hand sanitizer stations in every room.
Mm-hmm.
Kids were constantly being reminded to sneeze into your sleeve and wash your hands.
Mm-hmm.
Many of those practices we will continue.
Sure.
Sneeze into your sleeve.
Makes sense.
Wash your hands.
Mm-hmm.
Right? Will we be as obsessive about it? Hopefully we won't have to be.
Right.
But this year, every time our kids walked into the building, our teachers were there to greet them with
Hand sanitizer.
hand sanitizer and
Yep.
squirt the hands.
Yeah.
It was amazing to me how few cold and flu cases we had this year.
They were down.
Yeah. So we're prepared to do it again.
Sure.
And again, so our safe continuity plan is, let's hope we don't have to,
Right.
but we know how to do it.
Exactly.
And we're prepared to pull last year's reopening plan off the shelf and do it again.
Sure.
So the next one, again, that I want to make sure people are aware of that we know how to do it is contact tracing and quarantining people when needed.
Mm-hmm.
Our nurses this year were amazing. The second we had a confirmed case in one of our buildings, they had a protocol on how to contact trace anybody who might have been within, I think it was 6 feet for 15 minutes,
Yep.
that individual, and alert those individuals that they need to quarantine for 10 days.
Mm-hmm.
We're ready to do that again.
All right.
The big difference now is that if you're vaccinated, you don't have to quarantine.
Exactly.
So, again, our reopening plan is we know how to do it. We're prepared to do it. God forbid a new variant starts to have breakthrough in the vaccines.
Mm-hmm.
We know what to do.
Sure.
We know how to contact trace, and we know how to notify people that they're quarantined.
Mm-hmm.
And from coming into schools, hold them accountable for the period of quarantine that they must finish.
Right.
That's our hope, that we don't have to do that again, but we know how to do it.
Exactly. We don't have to reinvent the wheel.
Don't have to reinvent the wheel.
And again, from the standpoint of contact tracing, even if we have to, you're kind of concentrating more on the lower grades if they haven't been vaccinated.
Exactly. So, the only other two things that I just want to talk a little bit about, which are different now, is that if you remember correctly at the beginning of the pandemic, one of the major obstacles to fighting it was there was a lack of testing capacity.
Yep.
Do you remember that?
Yes, I do.
We didn't know where it was.
Right.
And it was difficult to get a test, and it took a long time to get the results. And we were talking about whether it's PCR or
right, two
the other
types of
tests,
tests,
and which was more accurate. Now, tests are everywhere.
Yes.
You can get tested today and know tomorrow.
Right.
So we're aware of that capacity, and where needed and when needed next year, we have a relationship with the community health district and can have on-site mobile testing when needed.
That works.
So we're going to consider it.
Sure.
Right? We know that is one of the tools in the tool belt. We did it this year with our prom.
Yep.
And we are prepared to do it again next year if we ever have a suspicion or a need.
Yep.
Either small scale, individual, or larger scale, maybe full classes of kids. Mm-hmm. So the capacity's there now. We know how to access it. It's in the back of our mind as we get ready to reopen how to use it.
Well, and again, that's with all of the rest of the tools that we have, and we've been there, we've done that. It's just a matter of if we need to take it out, we'll take it out.
Exactly. Then the last one I just want to reflect on briefly is vaccinations.
Yep.
We were blessed to have Russ Melman.
Oh, absolutely.
He is a hero.
Absolutely.
And his work and his team getting all of our faculty and staff vaccinated as soon as the window opened for us to do it was remarkable.
Yep.
Our teachers are vaccinated, our faculty and staff is vaccinated, and now our students 12 and over, go down to Walgreens, get your shot.
They're available readily.
So vaccinations are here. They're widely available. I suspect the next wave will be the booster shots we're probably all going to need at some point. But I'm not a medical expert. I don't know what those are going to be or when. Mm-hmm. But we will be prepared to work with Russ to provide those opportunities for people as soon as they become available.
Sure.
So with that said, our reopening plan, I'll give it to you formally, our Safe Return to In-Person Instruction and Continuity of Services plan is essentially all of the tools that we developed last summer are in our tool belt, and we are ready to use them at any time.
Right.
That's our plan.
Sure.
Our plan is to reopen fully 5 days a week, and let's go.
There you go.
Right.
Hit the ground running.
Hit the ground running.
For sure. I
anticipate that in the August timeframe, we'll start to be getting, they're called circular memos from the state.
The state.
With their guidance and their plans about what must be included, whether that's mask wearing as a requirement or a recommendation. We'll study those closely. We'll put the information out to our families and gather feedback. And we'll make our final decision about what school looks like come the end of August.
Sure. Now, I know, there was a fair amount of pushback on mask wearing and so forth, and not only in this district, but, I think across the state. Did you have any sense of basically the appetite or for the anti-vaxxers out there within the system? Is there a fair amount of that? Or?
I gotta tell you, it's one of those things.
Yeah.
Right. That some people are just not going to agree with it, no matter what.
Yeah.
I just got to remind everybody that we, as a local school district, at the beginning of this, made a commitment to follow the science.
Mm-hmm.
And by that, I mean follow the recommendations of the people who know, the epidemiologists.
Sure.
Not the people who think they know or know how to Google search a couple of things and become experts, but the people with the right letters after their name.
Yeah.
If those are the folks that we're going to listen to.
Yeah.
And that's period, full stop.
Yeah.
And when people are mad about masks, it's not going to be a Charles Britton educator decision.
Right.
It's going to be this is what the experts say we need to do.
Exactly.
I'm sorry you don't have an MD after your name or aren't a medical professional.
Right.
Go back to school and get that degree and become one.
Yeah.
And then we'll certainly
open a conversation.
Right. But and I don't mean that to be a jerk. I'm not qualified to say.
No. Right.
And at the end of the day, science has to prevail.
Sure. And I think overall, the epidemiology is out there, and like you say, we have Russ, who's at Chatham Health. His expertise and his degree is in epidemiology. So you're not going to find any more qualified person, as far as that goes.
He's a public health expert.
Absolutely.
And I've got to look at him and say, Russ, do the kids need to wear masks?
Yep.
And if he says, I strongly recommend it, that's what we're going to do.
That's what we're going to do. That's great.
Yeah.
Well, that's good. And again, I think we spoke before we went live. As far as that, the governor's emergency declaration has been extended, I think, to July 20th, right?
Right.
And so forth. So, he'll have the power, to do what he does, as far as that goes. I'm sure the circular letters are going to be coming out. In fact, I think I have one right here on the desk from the state of Connecticut.
Yep.
As far as that goes, but yeah, I think we've been very, very fortunate. I think your whole leadership team and the graduation came out phenomenally well. How was the feedback on the prom?
Everybody, the end of the year went swimmingly well. It was perfect. Dave, I would just end by saying we're in a really good spot.
Yeah.
Last summer, when we were making some of these decisions, we were terrified.
Yeah.
Right. We didn't know.
No.
I mean, we had certainly, if I could transport my brain back with all of the knowledge I have now and tell us what to do, lots of things we would have done differently.
Yeah.
Right. But, we were opening school unsure of if we would be a super spreader event.
Yeah.
We didn't know. Now we do. We know the measures we need to take.
Well, I think that was evident right down the line, even on the national level.
Of course.
This epidemic is, we were on uncharted waters from the get-go.
Uncharted. Yeah.
So, a lot of people could be, doing a lot of, armchair quarterbacking afterwards.
Of course.
But by the same token, we had the best knowledge that we had at the time. And that's the key. At the time, that was the recommendation or whatever. But, it's like a football game, okay, or a basketball game. When something's not working or something, you have to change it up.
That's right. That's what we did.
Yeah.
I've joked with you before. I am looking forward to talking about other things that aren't COVID, and I think we're close to that. So, I think our next we probably have, I hope, one more COVID conversation in us for August.
Okay.
And if that conversation is, hey, the vaccination for birth to 12 has been approved. We don't need masks. We're opening fully.
There you go.
Let's go. That's great. Then we can move on. But it may involve a conversation about some added length of time that we have to choose some of the mitigation strategies.
Right.
And then, we're going to have to be flexible as we move forward.
Sure.
But we're in a really good spot.
Absolutely. And, as far as in relation to the vaccines, the supply has definitely, met up with the demand. So, we're in a good spot there.
Good spot. And
so, for sure.
And our faculty, staff, and our students, oh my God, were remarkable.
Yes.
This year. They were remarkable.
Yeah. And it was, I think it was a stressful year for everybody.
Stressful year.
Doing double duties, with the PVLA and, everything else and all the things that, with the mitigation strategies, that was a whole nother game plan, as far as that goes. Yeah. But kudos to you and your leadership team and the teachers.
Yeah. And kudos to our nurses who saw us through this. Kudos to our counselors and social workers and psychologists and clinicians who saw us through this.
Yeah.
Great team.
Yeah, no, absolutely. Great. Well, that was awesome. I think this was, again, our episode number 15. And if we need to get another one in August or so. We'll certainly do that, and stay tuned. So
Thank you, Dave.
Go from there. So, all right, this is our Portland School District podcast. This is our episode number 15, and with our Superintendent of Schools, Charles Britton, and we're in our Town Tech Educational Podcast Studio. I'm your host, Dave Kosmiski. So have a great summer. Get out and enjoy yourself.
Perfect.
Thanks. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.